I always knew I wanted to be a nurse from when I can remember. My grandfather was sick when I was little, and I remember visiting him in the hospital. I don't have any nurses in the family, so that's not what led me that direction. But when we went to visit him, and I saw the care that the nurses gave, caring for him, I said, that's what I want to do. I want to be a nurse. My daughter, Anna, who's a sophomore at Hurricane High School, thought she always wanted to be a nurse, but we got her involved in the Junior Nursing Academy the first year, last year, and she absolutely fell in love day one. She came home and said, that's what I want to be, that's what I want to do, and validated that, and she was fortunate enough to come the next year to the Junior Academy, Senior Academy, I guess, and just keeps on rolling with that and can't wait to get started. That's how excited she is.
I can't wait to see when I'm a nurse and how many people will be coming back like I did and how it will influence the way they think. Because at first, I wanted to be a nurse, but this has just showed me that it's really, truly what I want to do.
For her, there is a healthcare track, but any math classes, science classes, anatomy is huge to take in high school as a pre-nursing track. And counselors at the school will help you, direct you that way. And grades are very important. You obviously want to have good grades, and you can get direct admissions into the local colleges for direct nursing. And that's not an easy thing to do, but if you have good grades and a good ACT and you do well in your classes and volunteer, then that gives you that opportunity. So that's what she's working on now. I'm a clinical management coordinator on the unit, and the training that I received for that role, I went from the bedside nurse to a charge nurse and then to the coordinator. The CMC University is actually connected with CMC and offers classes for their staff to continue in education in different tracks, and that one that we take for that role is the leadership track. So that gives you not only the systems that you need, but also the people, the leadership for the people that you're going to be managing or leading. Bedside nursing is very difficult. It's 24/7, 365 days a year. It's not an office job, but the rewards outweigh any day that you could be here or any time you can be here, and when you're helping somebody at their most sickest day or their most critical time. That you have an opportunity to change somebody's life just by smiling and being kind, but let alone trying to save a life. But you can also make a difference on somebody in the hallway that you don't know was just told their family member had cancer or is dying, and you are the first person that they see, and your kindness can go a long way. And I think that we have that opportunity every day, and that's huge, and that is so rewarding. And I'm thrilled that my daughter is following in those footsteps, and I think that there's no job better than a nurse.